I'm Dr. Crystal Nix, chiropractor and certified acupuncturist, and I wanted to introduce you guys to my husband, Dr. Joel Dayton.
Hey guys.
He's also a chiropractor, but he's a CCEP, which is a certified chiropractic extremity practitioner. So we're gonna actually be tapping on him today because we're focused right now during this winter season on the water element being out of balance. So if you remember from some of the past videos, the water element deals with two meridians in particular. There's the bladder meridian and the kidney meridian. So the bladder meridian deals more with the back. And we were talking about how in the winter that deals a lot more with joint pain when we're out of balance. So Dr. Dayton today is going to actually be treating me and showing you guys a few ideas of what you can be doing at home to take care of some of your back issues.
Great.
So we'll let you go on and lead us.
Awesome.
Okay.
So what we're going to do, I'm going to give you 3 tests that you can kind of help determine if you have something going on that's maybe a little bit more serious, and that would be a disc issue. And then we're going to do a little bit of treatment, and then we will give you some things that if you do have a disc issue going on, movements that you can avoid so you don't make it worse. All these you can work with a practitioner for sure, but these will be some things to help you determine for yourself or weed out some things and be able to know what might be going on with you. So the first thing we're going to do is we're going to do a couple of tests. So we're going to stand up back here.
Yeah.
And the first thing I'm going to have Dr. Nix do, this would be to see if we have a end plate that is pushing on a disc in our back and if it's aggravating it. So, and this would be to rule out something that might aggravate it through a compressive force. So first thing I'm going to have you do is you're going to go up on your toes and then you're going to drop just all your weight down. So go ahead and do that.
Okay.
Drop all the way down, and you should just let your full body weight go down. Now, if that caused pain in your back, did that cause pain in your back?
I'm good.
No problems?
Yeah.
Okay. If that caused pain in her back or pain going down her legs, then what we would do is we'd say, okay, I want you to contract your abdominal muscles,
Okay.
and then I want you to do the same thing. Come up on your toes,
Okay.
drop down on your heels.
And back down.
Yep. Now, if she had pain before, and then she contracted her abdominal muscles and that caused it to subside, then we would say, okay, that's actually a good sign. That means that we can actually work some of your core muscles to help stabilize your back. That would be a good scenario if you had a disc issue.
Cool.
Okay. So the next thing I'm gonna have you do is I'm gonna have you sit in this stool. And so at home you could just sit in a chair. And what I'm gonna do, actually, can I bring this up just a little bit?
Yeah.
So
let's,
can make sure we see. Awesome, perfect. So at home, what you would do is you would want to sit up straight in this chair, have your back straight, and then what you're going to do, I'm going to have her pull on the bottom of the chair, and she's going to pull herself into the chair as hard as she can.
Okay.
Go ahead and pull.
Pulling.
Okay, perfect. Now, if that caused pain, that didn't cause you pain, right?
I'm feeling all right.
Good, no disc issue. If that did cause pain, then we'd think, okay, we do have a disc issue. If we want to, then I'm going to have her flex forward
Okay.
and do the same thing. Pull down into the chair.
All right.
And again, if that caused pain, then we would know that we don't want to do any type of flexion motions because that is going to aggravate that disc even more. So if we're doing any exercises or stretches that are in a flexion motion,
Crunches.
yeah, absolutely. Yep.
Yeah.
No crunches, nothing flexed forward, because that's going to aggravate that disc even more.
Okay.
All right, so the third test that we're going to do, you need a friend. You can't do this on your own, so I'm your friend.
Thank you.
So you're going to take your legs and come up like this, and she should have her legs relaxed and her back relaxed, and I'm going to be doing the work for her as her friend. So I'm going to take her legs like this at a 90-degree angle, and then we're going to rotate like this, come to a 45-degree angle this way, and then we're going to go back the other way, that way. And if that caused her any pain in her back or legs, then we would think that the injury, if she had a disc injury, that it was caused by a rotational component, and we'd want to try and limit rotation when we're doing different movements or just going about our day. Okay? So let me show you, since Dr. Nix doesn't have any of those issues, we're going to adjust her, and then I'm going to show you a couple of ways that we can have her avoid some motions that might hurt. So I'm going to have her roll over onto her stomach.
What I liked about those movements that you showed was that, one, you're showing us, okay, if we have any issues with flexion, what to avoid if we are aggravated, also with now rotation as well. So those are really great tips, yeah.
So I'm just going to check something with her legs really quick. She actually looks pretty good here. So what I'm going to do, I'm going to have her raise this leg up towards the ceiling, just like this. I'm going to push down, she's going to push up, and I'm going to check how well her muscles can fire. Pretty good, okay. Push towards my hand here, and push back towards my hand here. Now, I check her muscles bilaterally, because in this case, I'm trying to see how her glutes and hamstrings are firing. Because Dr. Nix has been having a little bit of back pain, and so I'm going to be trying to associate that with different levels of the spine. You have nerves that come out at each level of your spine, and those nerves control certain muscles in your body. So what I'm trying to do is focus on the lower spine, or see if she has anything going on in the lower spine by looking at the different muscle groups and seeing if they make a difference if we test them and if they are able to hold up the way they're supposed to. So hold your leg like this. I'm going to push down, you push up towards the ceiling. Hold, and she kind of has some issues there pushing on that right side.
Definitely feel weaker.
Yeah. So I'm going to go ahead and have her push here and then push back towards, okay, cool. So what I'm going to do, her lumbar spine, in her lower lumbar spine, that's what controls the glute and hamstrings. And I'm going to be focusing on this side to see if we can get those muscles on that side to fire a little bit better. So I'm going to use, this table is called a drop table, and it makes a loud noise, but it doesn't hurt. It's not scary. It actually is a very soft adjustment technique, and that's why I prefer it. But what I do is I cock up this table like this, and then it drops that way. And it allows me to not have to put as much force into someone when I adjust. So I really prefer adjusting this way. So I'm going to focus on this part of the spine right here, and we're going to be pushing down. Just like that. And then I'm going to take this leg.
That's good.
Is that okay?
Yeah.
All right. Well, I paid her to say that, so go ahead and raise this leg up. Hold here, I'm going to push down, and she's able to hold that better now.
I felt much stronger.
Glutes feeling better, or it's firing better, so that's a good sign. Go ahead and push back towards me here.
Okay.
Push back towards me here.
Okay.
Great, perfect. Relax that leg.
Nice.
And that is adjustment.
That was awesome. Thank you
So,
for that.
yeah, now what we're going to do is I'm going to show her a couple of ways how she can get avoid common ways that would be aggravating to her back if she did have a disc issue, okay? So whenever you're having a back issue, I always try and get people to move out of bed in a similar way. So I'm gonna actually have her, she doesn't have a back issue right now, but I'm gonna have her roll over on her back, meaning she doesn't have a disc back issue, but she does have a little achiness in her back.
So that wasn't the example. This
No.
part's the example.
Right. So what I'm gonna have her do, I'm gonna have her pretend that she has a metal rod going from here down to here in her hip. And
So from the lower ribs? Is
yeah,
that
from the
what you're
lower
saying?
rib right there. And I want them to move together while she rolls over onto her side, okay? So this, obviously, if she slept on the left side of the bed, then she'd want to roll out towards the left, and she'd want to tuck her left hip underneath her to get out of bed. So we're gonna have you roll over to that side, and you're gonna pretend like those are moving together, okay? Not pretend, make sure those are moving together. Good, perfect, good, great. So we don't want to create a situation where we have rotation, happening with one without the other. So the ribs shouldn't move without the hips, right? So they should move together.
So
like
no
this.
twisting.
No twisting,
Yeah.
right?
Okay, cool.
And then what we're going to have you do, I'm going to have you swing your legs out here,
Okay.
and then you're going to push up with your elbow
All right.
and your hand.
Doing it.
Yep, and you're going to come up this way.
All right.
Just like that. Perfect. So what that does, again, is it limits how much rotation we have, and it limits our amount of flexion that we have. So you're not coming and doing a sit-up to get out of bed, and you're also not twisting to get out of bed. So that's the best way to get out of bed, especially when you're dealing with a disc issue. So we've got a couple others. We're going to go to the other room and I'll show you those. So the second thing that people do every day is sit and stand. And so I'm going to teach you how to go from a sitting position to a standing position and how to do it with the least amount of strain on your body. Especially with people who have disc issues, it can be very, very painful if they stand in the normal way. And I say normal because that's the way that most people stand up. And let me show you how that is. So most people, and I will exaggerate because people don't stand exactly like this, but I'm going to exaggerate. But most people will come like this, and then they're going to come up. Let me show you that from the side. So they're going to come like this, bend over, and then they're going to come up. Now, let me show you about why biomechanically that can be really hard for people who have disc issues. So if we lean over here, and then we push ourselves off forward, what we end up doing is we have to contract, at this point, we have to contract our back muscles to pull ourselves back in this position. That can put a lot of strain on the discs. It pushes them, compresses them. So if we have a disc that's already aggravated, compressing them even more is not going to help. So here's an alternative. Instead of going forward, we're going to try and go up. We're going to try and stand up. So things you want to focus on is contracting your abdominal muscles, your abs, and then also contracting your glutes. So the abs will help keep a nice, firm position for our core, and then our glutes are going to push us forward. Now, here's a little secret. If you look up, you're more likely to stand up. So if you're having disc-related pain, just look up towards the ceiling, and this is how it should look. You're going to keep your feet just about, hip width apart. Don't bring your feet in close. That'll be hard to do, sit to stand. And then what we're going to do, we're going to contract the glutes, and we're going to go upwards. So it looks like this. And I'm squeezing the glutes, pushing the pelvis forward. So I'm going to show you from the side how that looks also. Should look like this. We're going to contract the glutes, contract the abs first, and the glutes are going to push us up. Like that. Cool. When you sit and stand, if you do it that way and it decreases your pain, that's a really good sign. Again, it shows us that we can help stabilize some muscles in your core, and that will decrease our chances of re-aggravating that disc. The last thing I want to talk to you about is walking. Again, something that people do every single day. Now, when people have disc pain, a lot of times I'll see people walking like this. They'll come into the office, they'll walk like that. They'll walk very slowly, and they won't swing their arms. They're very stiff, and the body is trying to stay stiff in order to encourage, it's trying to lock down and create safety, security for those discs. But unfortunately, there's a different way that we can do it, that we can actually encourage muscles to help support the area, and it can help relieve a lot of symptoms also. And that's simply by the way we walk. So rather than if you have back pain, if you have a disc issue, walking like this, instead if you swing your arms, you contract a muscle called the latissimus dorsi, the lats. That's a muscle that starts here in the shoulder. It goes underneath through your armpit, and it goes down into the back and then inserts into your pelvis back here. So instead of walking like this without swinging your arms, if you can swing your arms like this, you'll activate those lats, and by activating those lats, it creates stabilization for the back. So when people have a disc issue and it's coming out of its acute phase, by doing this, when people walk, they can really see a difference and it decreases their symptoms. Oops.
All right, we wanted to thank Dr. Dayton again for sharing such awesome information on how we can be able to support our backs.
She invited me all the way down from the other hall. Thank you.
That's right. So we hope that this can support you, especially during the winter months when the water element can be a little bit more out of balance. So we're going to also go over a few other tips and chiropractic ideas in months to come, specifically tailored for the water element during February and March. And then we'll do some of the other seasons and other parts of the body that can sometimes get kind of tweaked during different seasons of the year. And we'll be tapping on Dr. Dayton again during those. So we hope you enjoyed today, and we look forward to seeing you guys again next time.